Yeah.
Let's go back just a little bit and talk about some of the services that were really dominating the landscape 20 years ago.
Yeah. So as you know, Bo, but for the audience, I sort of started in digital health on the parts of the healthcare world that I've always bridged consumer and healthcare. So a lot of that was in weight management, in physical activity, in sort of the call it medication elements of diabetes. And if we think back 20 years, like really none of that existed. There wasn't even really a great name. It's hard to imagine, but I started doing this before Fitbit existed, before there was an iPhone. We were sort of hacking at SDKs for research quality accelerometers to build visualization of physical activity and programs. And so there was a handful of people, and most of the early stuff was actually done at research universities. I know you've worked with a number. And so some of the early work was building things in partnership with the university to figure out how to take it. So for us at Canary Health, I was doing it with the University of Pittsburgh, building the online version of the diabetes prevention program, and then trying to figure out how you might sell that. This is before the DPP even existed, before there was reimbursement. And so it was not really much of an industry at all. There was not even mHealth or eHealth, which really came 5-10 years later as the iPhone became a real thing. But if we fast forward, the kind of 2012, 2013 is when you start seeing the first set of companies that we'd all know the names of. So Omada and Vongo were sort of founded then. And most of the early work was still in diabetes, but found a way to couple medical devices that people needed with kind of the coaching and kind of telemedicine. I had the good fortune actually of meeting Jason Gorovich right after he became CEO of Teladoc when I was working for a small company in Connecticut. And Teladoc in 2011 was 10 million in revenue and 20 people. And, maybe exaggerating, but it was not a big company by any stretch. And, obviously it has gone on to do stuff. So it was really 15 years ago, sort of the start of all this. And I think what we've seen over the years is how it has become more and more about care and enabled by technology and less about the tech at start.